Crystal. I'm going to be your student nurse today. How are you doing?
I'm good. How are you?
Good. Before we begin, I'm going to provide privacy. Can you verify your name and date of birth for me?
Shakira Banks, 0523-2002.
Perfect. I'm just going to check your wristband. Okay, and now I'm going to perform proper hand hygiene. So today we're doing a head-to-toe assessment of your body systems. Just to make sure everything is fine, nothing's abnormal. If you have any questions, just feel free to stop me, okay? I'm going to start with your head. Your head is normal, phallic, and midline. Next, I'm going to palpate your head. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay. Upon palpation of the head, there's no pain, tenderness, or masses noted. Next, I'm going to assess your facial features. I'm going to have you do some motions, okay? I need you to rotate your forehead, squeeze your eyes shut, clench your teeth, smile, and puff out your cheeks. All right, your facial features are symmetric at rest and smooth and symmetric with movement. Cranial nerves 5 and 7 are intact. Okay, now I'm going to assess your taste. I'm going to have you close your eyes. I'm going to place something in your hand, and I want you to tell me what it tastes like.
Sweet, salty. Sour.
Okay. Patient correctly identified sweet sour taste. Cranial nerve 7 is intact. Okay, now we're going to move on to the eye portion of the exam. All right, I'm just going to shine my pen light briefly in your eyes. Okay, upon inspection of the eyes, there's no scleral icterus, yellowing, or protrusions noted. I did forget a part in our previous assessment, so I'm going to jump back quickly. Okay, I need to palpate your frontal and maxillary sinuses bilaterally. Just let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay, perfect. Okay, so upon palpation of bilateral frontal and maxillary sinuses, there's no pain or tenderness. Now, picking up where I left off with the eyes, we said there was no scleral icterus or protrusions noted. Now I'm going to do a diagnostic positions test. Sitting how you are, I just want you to follow my pen light with your eyes. Okay, other side. Okay, perfect. Your eyes move smoothly through all 6 fields of gaze. No nystagmus noted. Cranial nerves 3, 4, and 6 are intact. Okay, now I'm just going to have you look directly at me. I'm going to shine the light in your eyes again. And then the other side. Okay, perfect. Now I'm going to have you to stare off at a distant object, and I want you to shift your gaze when my pen light comes to focus. Okay, perfect. All right. So your eyes were 4 millimeters bilaterally before light was introduced. They constricted to 2 millimeters bilaterally after light was introduced. Your pupils accommodated appropriately from distant to near object, and your pupils are equal, round, and reactive to light and accommodation. All right, now I'm going to assess your red light reflex. I'm going to use my ophthalmoscope. Okay. I'm going to hold my ophthalmoscope no longer than 12 inches away from your face, and I'm just going to look at both of your eyes. Okay, other side. Okay, the red reflex is present bilaterally. Okay, that concludes the portion for the eyes. Now we're going to move on to your ears. I'm just going to go ahead and look at your ears really quickly. All right, so upon inspection of the ears, for the bilateral auricles, there's no erythema or crusting. Now I'm going to palpate. Just let me know if you feel any pain or tenderness. Any pain or tenderness? Okay, upon palpation of the bilateral auricles, there's no pain or tenderness. Now I'm going to do the whisper test. I'm going to stand 2 feet behind you, and I'm going to have you to include the opposite ear. All right, I'm just going to whisper some words for you, and just repeat them back.
Dog, cat, rat.
Okay, perfect. And then I'm going to go to the other side.
1, 2, 3.
Okay, perfect. Okay, patient was able to successfully repeat the 6 whisper words. Cranial nerve 8 is intact. Next, I'm going to perform the Weber test. I'm going to use my tuning fork, and I'm going to activate it by striking my hand. I'm going to place this in the middle of your head. Let me know where the sound is best heard.
In both ears.
Okay. Patient can hear the sound equally in both ears. No lateralization noted. All right, now I'm going to look into your ears, okay? Okay, since I'm looking in your left ear, I'm going to use my left hand. I'm going to pull your pinna up and back. Alright, now I'm going to look in the other ear. Alright, since I'm on your right side, I'm going to use my right hand and just pull the pinna up and back. Okay? Alright. Okay. Alright, so upon inspection of the ear, I visualize that the bilateral ear canals are patent. The bilateral external ear canals reveal no foreign bodies, no edema, no excessive cerumen, and no discharge. The bilateral tympanic membranes are intact. They're pearly gray and translucent. And the cone of light was visualized at the 5 o'clock position on the right, in the right ear, and the 7 o'clock position in the left ear. Okay. Now we're going to move on to your nose and your mouth. All right, I'm just going to have you to occlude one nostril at a time and inhale for me. Okay, and then the other. Okay, your nose appears midline and bilateral nares are patent. Then I'm going to have you to identify a familiar scent. I'm just going to have you to close your eyes and occlude one nostril at a time and let me know what you smell.
Alcohol.
Okay.
Alcohol.
All right, patient was able to correctly identify familiar scent. Cranial nerve 1 is intact. Now we're going to move on to the mouth portion. Okay, I'm just going to have you to open your mouth for me. I'm going to place my tongue first on your tongue. Okay, and now lift your tongue for me. Okay, perfect. Upon visualization of the mouth, I saw the hard palate, the soft palate, the buccal mucosa, posterior pharynx, and tongue are pink and moist without lesions. The uvula is midline and frenulum is intact. Tonsils are present in 2+. Okay, then I'm going to have you to smile for me. I'm going to just shine a light. The teeth appears in good hygiene and they are white. No dental caries noted. Okay, now I'm going to have you to stick your tongue out for me. Then move it to the left and then move it to the right. Okay, patient was able to stick out tongue midline and move it left to right on command without deviation. Cranial nerve 12 is intact. Okay, I'm going to have you to open your mouth for me one more time. But before we do that, I want you to swallow for me. All right, and then open your mouth one more time. All right, I'm going to assess your gag reflex. Okay, and then after that, I want you to open your mouth again and say, ah, ah. Okay, perfect. All right, so patient is able to swallow on command without difficulty. Gag reflex is intact, and soft palate and uvula rise and fall symmetrically when patient is asked to say ah. Cranial nerves 9 and 10 are intact. Okay, so we've done your head, your eyes, your ears, nose, and mouth. So let's move on to your neck. Okay, I'm going to palpate your trachea on one side at a time. Let me know if you feel any pain or tenderness. Okay, no pain or tenderness? Okay, so your trachea appears midline and there is no pain or tenderness upon palpation. Okay, next I'm going to palpate your lymph nodes. Just let me know if you feel any pain or tenderness. Pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial cervical, deep cervical, and supraclavicular. Any pain or tenderness? Okay, so lymph nodes are non-palpable and no pain or tenderness upon palpation. Okay, next I'm going to palpate your carotid arteries one at a time. Okay, other side. All right, perfect. Now I'm going to go ahead and take a listen. I just need you to inhale, exhale, and hold. I'm going to use the belt of my stethoscope. Are you ready? All right, inhale, exhale, and hold.
Pulses are 2 plus even and regular. No bilaterally. No
Okay, and then same on this side.
Next, I'm going to move on to your skin. Just by looking at it, I can see
Okay,
that your skin.
perfect. The carotid pulses are 2 plus regular and even, bilaterally, and there is no bruise oscillated bilaterally. Okay, so now we're going to go ahead and move on to your skin. Your skin appears appropriate for race and ethnicity, and your pigment is even throughout. Now I'm going to assess your skin turgor by pinching your skin above your clavicle. All right, you have good skin turgor and no tinting noted. Next, I'm going to assess the temperature of your arms and legs using the dorsal side of my hands.
Next, I'm going to have you sit with your knees to the side right here.
Okay, your skin is warm and dry to touch, and yeah, your skin is warm and dry to touch in upper and lower extremities bilaterally. Okay, now we're going to move on to the cardiovascular and respiratory portion. All right, upon inspection of your chest, the chest is symmetrical with no deformities. Now I'm going to check your AP to transverse ratio. I'm going to have you lift your hands for me. AP to transverse ratio is 1 to 2. And I'm going to have you to just shift sideways for me. So now I'm going to put my hands around your torso with my thumbs on the T9 position. I want you to inhale and exhale deeply for me. All right. Posterior chest expansion is equal bilaterally, and breathing is regular, even, and unlabored. Now I'm going to listen to your lung sounds. Okay. I just need you to breathe in and out every time you feel my stethoscope on a new location. I'm going to find your sternum. All right, can you shift me to the, okay. Okay, and then the other side.
Take a deep breath in.
Okay, and then slightly up for me. And then the other side. Okay, now I'm going to listen on the posterior side. All right. I'm going to find your spine, and I'm going to avoid listening over your scapula. Go ahead and breathe in and out for me. Other side.
All right. Lung sounds clear in all lung fields. Upper and anterior. Lung sounds clear in all lung fields, anteriorly and posteriorly.
Okay. Your breath sounds are clear in all lung fields, anteriorly and posteriorly.
Next, I'm going to listen.
All right. Now I'm going to go ahead and take a listen to your heart. So yeah, your lung sounds clear, anteriorly, posteriorly, bilaterally. Okay, now I'm gonna listen, take a listen to your heart. Okay, I'm just gonna listen. All right, you ready? You can just breathe normally.
The fifth intercostal
And then
space,
shake the rest
left
of
side
your
sternal border,
heart.
but so close to the sternum. And we have the mitral,
Okay.
which is the left upper sternal border, midclavicular line, and fifth intercostal space.
Okay, I listened to the aortic, which is to the right of the sternum border in the second intercostal space. I listened to the pulmonic, which is also on the second intercostal space, but to the left of the sternum border. I listened to the tricuspid, which is in the fifth intercostal space, left of the sternum border, close to the sternum. And I listened to the mitral, which is in the fifth intercostal space, midclavicular line. S1 and S2 noted. There were no extra heart sounds or murmurs noted. Okay. Now, next thing that I'm going to do is check a chart.
Bilateral, brachial, radial, posterior tibialis, and dorsalis pedis pulses are 2 plus even and regular. Next, I'm going to assess your capillary refill.
Okay.
All
right, I'm back. We're going to just pick up where we left off. Okay, next I'm going to assess your pulses. You just hold your arms out for me. All right, your brachial, your radial,
capillary refill for less than 2 seconds.
your posterior tibialis,
Next, we're going to move on.
and your
So for this,
dorsalis
I'm just
pedis.
going to have you lay back.
Oh wait, I'm gonna leave those off right. Okay, so pulses are 2 plus, regular and even in the brachial, radial, posterior tibialis, and dorsalis pedis in upper and lower extremities. Now I'm going to assess your bilaterally, sorry, and I'm going to assess your capillary refill. You just put your hands out for me.
Next, I'm going to take a listen.
Okay. So capillary refill was less than 2 seconds in upper and lower extremities bilaterally. Okay. Now we're going to move along to your abdomen. All right, I'm just going to have you to lay back for me. Okay. The first thing that I'm going to do before listening is I'm just going to inspect your abdomen. All right, your abdomen is flat and umbilicus is midline. Then I'm going to go ahead and auscultate in all 4 quadrants, starting in the right lower quadrant and moving in a clockwise position.
All right, normal active bowel sounds, auscultating in all 4 quadrants. Next, I'm going to percuss, again starting in the right lower quadrant.
Okay, normal active vowel sounds are heard in all 4 quadrants. Next, I'm going to go ahead and percuss your abdomen. I'm going to do this by putting my fingers on your abdomen, and then I'm going to lightly strike between the knuckles of my middle finger.
Next, I'm going to do superficial and deep palpation. Let me know if there's any pain or tenderness when doing your case. So we're going to start with superficial.
Okay, Tiffany noted in all 4 quadrants. Okay, lastly, I'm going to palpate your abdomen. Let me know if you feel any pain or tenderness at any point. I'm going to start with light palpation using a one-handed technique. Okay, and now I'm going to do some deep palpation.
All right, abdomen is soft. No pain or tenderness noted upon superficial and deep palpation of the abdomen.
Okay, your abdomen is soft and there's no, oh, well, did you feel any pain or tenderness? Okay, there's no pain or tenderness upon superficial or deep palpation in all 4 quadrants. Okay, so now we are done with your abdomen. You go ahead and sit up. Okay, now we're going to move on to the musculoskeletal portion of the head to toe assessment. I'm just going to have you stand with me and I'm going to ask you to do some movements. Okay, so the first thing, oh, well, let me know if you feel any pain while doing this. The first thing we're going to do is we're going to start with the neck, and we're going to do flexion, bringing our chin to our chest. We're going to do extension, bringing our head to the ceiling. We're going to do lateral bending, bringing our ear to our shoulder, and then on the other side, and then rotation by looking side to side. Then we're going to do flexion and extension with our arms, bringing them up and then down, extension. Same thing with our legs, flexion, and then extension, other side, flexion and extension. Then we're going to do flexion, reaching down to touch our toes. Then we're going to do extension. Then we're going to do lateral bending on both sides. And then we're going to do rotation. All right, did you have any pain? Okay, patient has full range of motion in neck, arms, legs, and spine. Patient can complete movements with no pain, no crepitus, and no limitations. Okay, we're going to jump to the neuro portion quickly, and I'm going to have you do 2 cerebellar tests. I'm going to have you stand back there, and I need you to tandem walk for me, going heel to toe in a straight line. Okay, and then turn and go back to the starting point. Okay, perfect. Patient has successfully completed tandem walking smoothly with a steady gait and no loss of balance. Okay, the next test, I'm going to have you do flexion of one leg and then hop in place on the other. Okay, and then flexion of the other leg and then hop in place of the other. Okay, perfect. Patient is able to hop in place without difficulty. Okay, now you can go ahead and sit, and we're going to finish the rest of the neuro portion. Okay, now I'm going to go ahead and test your coordination. Can you put your palms to the ceiling and then put them down to the floor, and then repeat that movement as fast as you can. Okay, perfect. Patient can do movements accurately and smoothly. Okay, next I'm going to go ahead and test your senses. I'm going to have you to close your eyes and then let me know if you're feeling a light or sharp sensation, okay?
Sharp. Light. Light. Sharp.
Next, I'm going
Sharp.
to have you,
Sharp.
use this Q-tip,
Light.
and I'm gonna let you know what sharp and
Okay, perfect. Patient is able to differentiate between light and sharp touch in upper and lower extremities bilaterally. Okay, next I'm going to go ahead and test your diagnosis. I'm going to have you to close your eyes and put your hands out for me. I'm going to give you a familiar object in your hand, and you just tell me what you think it is.
Key.
All right, perfect.
A coin.
All right, great. All right, so diagnosis is intact in upper extremities bilaterally. Okay, great. Now we're going to go ahead and finish off the rest of the musculoskeletal portion. I'm going to assess your muscle strength. All right, I want you to grip my hands as hard as you can. Perfect. And then with your ankles, I want you to do plantar flexion and don't let me pull up. Okay, and then do dorsiflexion and don't let me push down. Okay, perfect. Patient's muscle strength is 5 by 5 bilaterally in upper and lower extremities. Then we're going to move on to your shoulder strength. I want you to shrug your shoulders for me. I'm going to try to push down. Don't let me push down. Okay, perfect. Shoulder strength is 5 by 5 bilaterally. Cranial nerve 11 is intact. Okay, well this concludes the portion our head to toe assessment. Do you have any questions for me? Okay. All right.